Healthy people regret their Medicare decision more than unhealthy people for three main reasons. Let's talk about what those reasons are so that you can avoid making these mistakes if you are a healthy person. Step number one is because of how Medicare's guarantee issuance or pre-existing condition rules exist. The thing is, when you go into Medicare, they're not talking about the rules for you to change in the future. So it's important to be aware of that. Here's what Medicare rules say. In most states, when you first join Medicare, you have a 6-month window where you can join any Medicare supplement plan of your choice, no matter what your pre-existing conditions are. However, after that 6-month window, if you try to join a new supplement plan or even change letters or change companies, in most cases, they're going to ask you for your medical health history and they're not required to accept you. So what does this mean? This means that if people go into Medicare initially being healthy and they become unhealthy, they likely cannot get that Medicare plan that they want that is best for them, for both their medical care as well as their costs when it comes to their health care. I had a woman who emailed me a few years ago whose dad had aggressive cancer. When he joined Medicare, he was healthy. He picked out a plan that was best for him when he was healthy. But with this cancer diagnosis, he can now not see his preferred doctor. And if he does, he'll have to pay for them out of pocket, which could be tens of thousands of dollars. So initially, number one, be aware of how Medicare rules work to change Medicare supplement plans in the future. Now, yes, it is easy for you to change Medicare Advantage or Medicare Part D plans every single year, but the key is the Medicare supplement plans. That's what people tend to want when they have health issues. Number two reason is just because of how the system is set up. Insurance companies entice you into these low-cost plans with these extra gym memberships and vision and dental and things like that. And if you go down that path with the commercials and you're not really sure what's actually happening, again, you can be misled later on. Those Advantage plans want healthy people because you are cheap, okay? You are cheap to cover, so they make a lot of money off of you. So they add those perks in there to entice you in. But when you're in there and you get not healthy, when you become unhealthy, those plans become very, very expensive. So please be cautious around these advertisements luring in those healthy people. While yes, I would also love a gym membership, in most cases, it's not usually worth it for most clients. We think about the overall goal of Medicare and how it ultimately works. Now, the third reason why people oftentimes, again, regret their decision is around cost. I kind of alluded to this throughout the workshop or throughout this video, but when it comes to cost, the key thing is that, Medicare Advantage plans, those $0 premium plans might save you, say, $30 a month when you're healthy. But when you're unhealthy, it can cost you between $2,000 and $10,000 more by being on the Advantage plan. So when it comes to cost, Advantage plans tend to be what people go towards when they're healthy. But the thing is, those costs can get expensive when you are unhealthy. Unfortunately, if you were always healthy, any plan will work for you, just the cheapest one will work. But if you ever think that you might want to use your healthcare, if you might have health issues for whatever it might be, please be thoughtful when you first join Medicare. Now, we have a proven process that we'll share with you in the link below and extra resources that if you follow these steps, if you avoid these mistakes, you can easily make your right decision that you're happy with both now as well as in the future. So again, please be careful when it comes to Medicare. Healthy people tend to make that wrong Medicare decision because of one, not realizing how guarantee issuance rules, how Medicare supplement rules work. Number two is all around the advertisements and how the Advantage plans are sold. And number three is all around the costs of Medicare and realizing how the costs really work when it comes to your Medicare coverage. Make sure you like this video to get more inside tips to help you easily make your right Medicare decision.